Hello, welcome to this NMC OSCE clinical skills video. Today I'm going to be looking at the insertion of the fine bore nasogastric tube. My name is Hannah. I am an experienced UK registered nurse for 20 years, a UK university lecturer, and I've also been an NMC OSCE lead. And when I started delivering OSCE training, there was so much poor quality information that was really inaccurate on the internet. So I wanted to try and improve that and share some of my top tips for passing and studying for the OSCE, but also to develop your knowledge and understanding for these key procedures when you are nursing in the UK. Okay, so we're going to be looking at the fine bore nasogastric tube. So this is one of the adult and child clinical skills stations for your NMC OSCE. It's a 12-minute station. Okay, and again, just thinking about why would we do this procedure? So we would pass the nasogastric tube down to support somebody with their feeding and nutrition, especially a fine bore one. And so we're thinking about anatomically, where's that tube going? Okay, so it's going down into the esophagus, into the stomach. Okay, and we want to be checking that it's in the stomach and in the right place, okay, and that we've not advanced and placed this tube down into the lungs, because you know anatomically your esophagus and your trachea, run right next to each other, so it can be quite a high risk procedure, and obviously lots of consequences if you insert the tube into the trachea instead of the esophagus. So there's key safety things that we need to do with this procedure as well to make sure we're not doing that. So you need to correctly measure and insert the fine bore nasogastric tube. I'm going to show you how to do that. You need to ensure patient safety and comfort throughout this procedure. That's really important. And you need to confirm that your NG tube has gone into the stomach by aspirating and checking the gastric contents and checking the pH. So what equipment will you have? So you'll most probably have like a clear nasogastric mannequin, like on the picture here on the right, okay? You'll have a receptacle, so like this blue kidney dish, okay? You'll also have your fine bore nasogastric tube, okay? Now, you might be used to these fine bore tubes that have a metal guide wire in them, but for the NMC test of competence, they don't use the guide wire ones, or they take out the guide wire, so you don't need to worry about removing a guide wire. You'll have your purple enteral syringe, okay, and this is a specific type of syringe which will only fit onto NG tubes, okay. It's part of our UK policy around safe administration of medications and feed with the correct syringe. So we always use a purple enteral syringe. You'll have some tape because you'll need to put the tape onto the nose and the cheek to secure the NG tube. You'll have some pH indicator strips to check your pH gastric contents, okay. You'll also need PPE for this station, gloves and apron, and you'll have some water to lubricate your tube. Paperwork and documentation, so you'll just have a standard scenario. There's no documentation required for this station. You don't need to document down that you've inserted the tube or the length of the tube for this station. In case you might have a simple scenario of just being asked to insert a fine bore nasogastric tube, okay, and it will give you the time required at the bottom. Just make sure you spend time to read through that scenario and identify any key information that you need to. Okay, so like all my clinical skills teaching, try and break it down into several different steps. You've got that mind map of how to go about this station, especially when you're nervous and when the time is ticking, okay? So like with all our stations, going to start with those key procedures, explain the procedure and gain the consent. I always go and collect and check my equipment then once I've got consent from the patient. I'm going to prepare the patient for the NG tube insertion. Okay, so some key verbalisation, some safety issues that we have to do there. I'm then going to do my next measurement. I'm going to show you what that is, but it's basically measuring the distance that the NG tube should be advanced to. Then you're going to go through the actual procedure of inserting the NG tube and securing that to the patient. You're going to confirm the position, so aspirating and checking the pH measurement, disposing of any waste, and checking the patient is comfortable and ending your station professionally. So key principles, so we'll just always check for safety, going to maintain privacy and dignity, quite an invasive procedure, so I'm going to make sure the curtains and the doors close, and I'm going to decontaminate my hands using the World Health Organization 7 steps before approaching the patient. I'm going to introduce myself, so using hello, my name is, and I would just always check ID for your patient to make sure you're doing the right procedure on the correct patient. That is a safety issue. Okay, so just getting them to confirm their name, date of birth and hospital number, and checking that against the wristband. Again, it is good practice to check for allergies, okay, with any procedure. So just asking them if they've got any allergies, and again, checking that against any documentation and if they've got red wristband. I'm going to explain the procedure and gain consent. So it's quite important to explain this procedure. Okay, not many people have had an NG tube down. It is quite uncomfortable. It's not a nice procedure at all. So explaining that you're going to be passing a tube down into the back of the throat and into the stomach, that it can be a little bit uncomfortable, can make the patient gag, okay, and can make them feel a bit sick. But you're going to give them a bowl in case that happens, and you're going to arrange a hand signal with them if they need to stop, okay. And just going to make sure your patient's comfortable and ready to start. Then I'm going to get my equipment, okay, so I would decontaminate my hands here because I've been up to the patient. Now I'm going to go away and get my equipment, okay. I'm going to get my fine bore NG tube, my water, my tape, my pH test strips, just check that they're dry, intact, haven't been, the colour hasn't changed. Get my 60 ml purple syringe and my kidney dish or my receptacle dish or my vomit bowl in case the patient vomits. Just going to confirm this equipment's all clean, intact, and expiry date test strips are dry as well. And really key verbalisation point here is to verbalise that you'd make sure you'd have working suction and oxygen at the bed space, okay? Now I do that with my equipment checks because it feels natural there because I'm doing all my equipment checks, so I'm going to put that key verbalisation in then, okay? And it is a real safety issue in case your patient develops respiratory difficulties, if you place the NG tube, you know, within the trachea, or any laryngospasm and things like that, okay? You're going to need your PPE, so your gloves and your apron for this station. Okay, so now I need to prepare my patient. Okay, so I've got my equipment, come back. I'm going to assist the patient into a semi-upright position, supporting the head with a pillow. That could be in the chair, or they could be kind of up in the bed at greater than 30 degrees. I'm going to arrange a hand signal with the patient. So, okay, so if you want me to stop at any time, just raise your hand like this, and I will do that, okay? I need them to check their nostrils, make sure they are clear, okay? Because I want to advance the tube down the clearest nostril, otherwise I'm going to cause lots of trauma, okay, if my nostril is blocked. So I'm going to get them to close one nostril with their finger and breathe in, and do exactly the same on the other side, okay? And ask them to tell me which one feels clearest, and that is where I'm going to, the nostril, I'm going to advance the NG tube down, okay? And I'm going to place that receptacle dish in front of the patient in case they are going to be sick or vomit, okay? So those are like key things that we need to do to prepare the patient, okay? So I'd always collect my equipment, prepare my patient, and now I need to do my next measurement, okay? So your next measurement is finding out really the distance you need to advance the NG tube, okay? So you can be assured that it is in the stomach, okay, until you test it. So you're going to take your NG tube and you're going to measure from the earlobe to the nose, okay? So put the end up there and to the nose, hold it on there, and you're going to measure all the way down to the episternum, okay? And then you should add a further 5 or 10 centimetres onto that. And you'll see on your tubes, there'll be a number, okay? And that will be, you need to verbalise that distance, okay? So it could be, for example, mine was 52 centimetres. So I'm going to advance the tube to 52 centimetres, okay? And that's a really important step to do, the next measurement. I'm going to decontaminate my hands, put on my PPE, okay? Or you could put on your PPE before you do your next measurement, that's absolutely fine. I'm going to make sure I cut 2 bits of tape, okay? So one piece of tape, I'm going to cut a little slit up the middle and make a pair of trousers, okay? And the other one, I'm just going to have a strip of tape, okay? That's because once I've got the tube in, I want to immediately adhere it to the patient, okay? I can't let go of that in order to cut tape. So get yourself prepared and organised, okay? I'm going to lubricate the end of my NG tube, okay? So I'm going to place this into my water I've got available, about 15 to 20 centimetres, okay? Give it a good lube because it can be a bit sticky on the mannequin, okay? And I'm going to insert the end of the tube into the clearest nostril. And I'm sliding backwards and inwards, okay, along the floor of the nose to the nasopharynx. And I'm going to verbalise that I would stop if I encountered any obstruction and try the other nostril. Then this is really important. So I'm going to ask the patient to start swallowing as the tube passes down the nasopharynx, okay? And this aids the tube going into the esophagus, but also minimises the risk of it going into the trachea as well, okay? And again, we do not want NG tubes into the airways at all. Really, really dangerous, okay? So I'm going to advance the tube through the pharynx as the patient swallows until I reach my next measurement reading. So for example, my 52 centimeters that I measured, okay? And until that is at the edge of the nostril here, okay? I'm going to verbalise that if there's any signs of coughing or breathlessness, then the tube would be removed immediately. Again, that's most probably because that tube has gone into the airways and not into the esophagus, okay? I'm going to use my tape. I'm going to tape it onto the nose, okay, and onto the side of the cheek as well. So important bit to remember, okay, both bits need to be secured. Then I'm going to confirm my position. I'm going to take the cap off my end of my NG tube and put on my purple enteral syringe. And most trust policies are that you should aspirate at least 5 mils back, okay, the minimum. And in your test centre, you might be given some aspirate in a pot, okay, but you need to go through the process of aspirating back. And then you need to put that aspirate onto a pH test strip, okay? So your pH must be less than 5.5 for you to confirm that this NG tube is in the stomach, okay? If the pH is greater than 5.5 or you can't get gastric contents back, then you'll need a chest x-ray to confirm, okay? Really important safety aspect there to verbalise. And then you must verbalise that you're going to check the position of this NG tube before commencing any feeding and before any nasogastric drug administration, okay? So every time it gets a position check. Again, a key bit of verbalisation that's obviously missed and can be a critical fail. Then I'm going to dispose of any waste, okay? I'm going to remove my gloves and apron and everything will go into the clinical orange waste bin. And I'm going to decontaminate my hands using that World Health Organization 7 steps. And then I just need to check my patient's comfortable. Obviously quite a invasive procedure, so just make sure they are comfortable, not in any pain, that they don't need anything. Ensure that they've got the call bell and they know how to press it if they need assistance. And I'm just going to finish my station with my final hand decontamination using the World Health Organization 7 steps. Don't need to document anything for this station, but I would personally verbalise that I would document that I've inserted the tube in the notes and the measurement of that tube. And that's a safety issue as well, because the next person coming on shift can check that the tube hasn't moved as well by also confirming the distance on the tube as well as the pH. So my top tips for this station, so check all your equipment and don't forget to verbalise having working suction and oxygen at the bed space. Prepare the patient, so think about their positioning, supporting them with a pillow, hand signal, okay, and checking the nostrils are clear. Complete and verbalise your next measurement, absolutely essential. Advance the NG tube, asking the patient to swallow, and also verbalising you would remove it if there's any coughing or breathlessness. Secure the top of the NG tube at the nose and the cheek, okay. Aspirate and check that the pH is less than 5.5, okay, to confirm position. If not, it will need a chest x-ray. Verbalise checking the NG tube aspirate position before feeding and any medication administration. Okay, hope you found that helpful. I'm available for one-to-one, small group OSCE training, face-to-face or online, okay? You get access to all my teaching resources, okay? API scenarios, care plans, evidence-based scenarios, detailed clinical skills videos as well. Can do mock OSCEs, again, online and face-to-face and get one-to-one feedback. Those are so good for improving yourself before you got to test and for increasing your chances of first-time pass rate. And also offer ongoing email and WhatsApp support. And you can email me on hannah.lames@outlook.com, or you can visit Nurse Tutor, Tutoring with Hannah, or my website as well, nursetutor.com.